Hey all, Eric Christensen, pharmacist here from meded101.com. Today I'm going to cover the Board Certified Ambulatory Care Pharmacy exam, formerly known as BCACP certification. My background, I'm board certified in geriatrics, pharmacotherapy, and certainly have worked with quite a few folks who have obtained the ambulatory care certification as well, which I have certainly contemplated. I'm going to use a lot of the info I've learned from my study process and the application process, in kind of teaching you about the board certified ambulatory care exam. And certainly I have collaborated, done some research on what topics need to be studied for this exam, as well as BCPS and BCGP. Those are the ones that I am definitely most familiar with. So let's get into it. Application information. Just like all the other exams, certification exams, spring and fall testing windows. Usually it's in the late April, early May timeframe, and late September, early October timeframe. It is expensive to get those certification credentials. Actually, simply to take the exam is expensive, even if you don't pass, which, around a third of people that take this exam do not pass. So it's very difficult. But that cost is yours regardless of whether you pass or not. So that was definitely a motivator in me taking board certification exams to make sure to do my best to study to pass it the first time. Application deadline is usually before, a couple of months before the testing window. So if you decide April 1st you're going to take the spring exam, sorry, BPS probably will not let you do that because the application deadline is passed. So I would refer you to the Board of Pharmaceutical Specialties website, BPS, for that specific information. I believe they come out with it early in 2019 here. We're late 2018 at this time. So keep an eye on that deadline because you do need to decide in advance for sure. Now, eligibility. This is a question I get on my website, meded101.com. People email me, reach out. What do I have to do to take this exam? And so here's the current criteria. They have changed these over the years. So this is 2018. Licensed pharmacist. Okay, that kind of makes sense. So, pass your MAPLEX, get your license, so on and so forth. If you have not done a residency, it's 4 years of pharmacist licensure experience, basically working out in the world as a pharmacist. Now, 50% of that time needs to be doing ambulatory care activities. Now, this is always a question that people ask me as well. And bottom line, what BPS has now gone to, or is going to, I believe, starting in 2019, is employer attestation. So basically, your employer signing off that, yes, you do 50% of your time in these activities. And those activities are outlined in the BCACP content outline. Okay, so definitely go check that out. I would say overwhelmingly the majority of pharmacists are covered by this. I've heard of a couple rare instances of them auditing and checking that. But again, I would think with the employer attesting that you fall into that criteria, I think you should be fine. I wouldn't anticipate many employers getting uptight about signing off on that. But that may be a challenge, but keep in mind you need to get that in place for your application. So 4 years post-licensure experience, unless you've had a residency. If you've done a residency, then it's 1 and 1. So 1 year of residency and 1 more additional year of experience as a pharmacist. And again, targeting that 50% ambulatory care activities. Or if you've done a PGY2 specialty ambulatory care residency, then you're pretty much good to go. You've got 2 years of experience and you're specialized. That's probably where your focus area is going to be for your career, at least initially. And so this is an either-or thing. So either 4 years or the 1+1 or the PGY1, PGY2 specialty in ambulatory care. And then, of course, they're going to make you pay your bill as well before they let you sit for the exam. Exam info, another question I always get asked on these board certification exams. So 175 questions, multiple choice, only one correct answer. Okay, so if you've taken the NAPLEX in the last 2, 3, 4 years, something like that, and you're looking at maybe doing certification, it is a bit different than the NAPLEX in that you don't have any fill in the blank, you don't have any multiple choice, which is kind of a sigh of relief, but the questions are very difficult and challenging too. So keep that in mind as well. Just because it's all multiple choice, only 4 answers, only one choice is the best or correct answer. That doesn't necessarily mean it's easy, and obviously by the pass rates, it's not an easy exam. One other, which I think is relieving thing for folks, is it is only generic names. So that can really help us out as far as if we're not exactly sure on a drug, maybe you can pin it to a similar class as long as an ending is the same or something like that. So generic names only for these exams versus NAPLEX. Again, if you've taken that in the last several years, they can throw out a bunch of different brand names at you. Now, one important thing for the time of the exam, finishing up here kind of on basic info, is it's just over 4 hours. I believe it's like 4 hours and just about 30 minutes to take the exam for 175 questions. Okay, so if you do the math on that, that's not a lot of time per question. So you do have to work at being efficient, which is one of the big reasons I encourage doing a practice exam, just to make sure that you're going to get through the material in the amount of time that you think you can, because you don't get penalized for guessing, at least not to my knowledge. They're kind of they kind of hide a little bit as far as exactly how the exam's graded and weighted. But yeah, from my understanding, you do not get penalized for guessing, so you absolutely want to get through all the questions and give your best guess, because you're definitely not going to know every answer on the exam. Okay, it's not that easy for sure. So results historically and pass rates. First off, pass rates. BCPS, BCGP, BCACP, historically, as BCPS and BCACP have been in the 60 to 70% range for pass rates. Okay, and maybe more towards the lower end of 60% of that range. So again, you're looking at a third of people, or 2 out of 5 are going to fail. So if you do fail, I wouldn't think it's the end of the world, okay? Because there's going to be lots of other people out there that don't pass as well. So keep going, keep learning, keep working towards it. I definitely have been contacted by numerous people that have had trouble passing and have worked and ultimately have succeeded. So not an easy thing to fail an exam. Certainly something that's not fun if you've ever done poorly on an exam. But certainly there are other folks out there, and you're not the only one, definitely. One of the frustrating things after you take the exam is waiting for results. and these can take up to a couple of months before you get your results. So do not expect them to be printed off after you get done taking your exam. That's not going to happen. So again, if you fail, which 33% in that range do fail, my encouragement would be to get back and get after it again right away, because you're going to have an added advantage in that you've actually seen the exam and you know kind of what the format is, what the layout is. So you'll be much more comfortable and much more ready the second time you take it, and have a little bit more of an advantage actually than somebody who's taking it the first time. So get back on that horse. The outline of the exam, there's 5 different domains. So you can see, pharmacotherapy, collaborative and patient advocacy, translation of evidence into practice, practice models and policy, population and public health. The way I think of this is, the clinical portion of the exam, is probably going to be in the ballpark of, 50 to 60%, where it's, things relating to drugs and working with patients and best selection and things like that. So that's going to be the majority of the exam. However, do not forget about statistics. Do not forget about regulatory. And I think I've got a slide coming up here too. And do not forget about ambulatory care practice pearls, which we've certainly tried to incorporate into all of our study materials. Because if you can knock those questions or get most of those right and knock them out of the park, that's certainly a big boost in your favor, even if maybe you struggle with remembering the drug of choice for psoriasis or something like that. So important to recognize and go through the content outline and make sure you're studying material from all those different domains. We've tried to take the legwork out of it for you, and I'll talk about kind of our study materials at the end here. But kind of those tips as far as the clinical rationale. Think broad. I mean, there's a ton of different disease states, ton of different topics that you can be tested on. So in an exam like this, where they're trying to test you on your clinical background, can you appropriately select the best medication out of multiple reasonable or potentially reasonable options? So again, kind of going back to maybe comparing this to the NAPLEX exam, NAPLEX probably focuses a little bit more on, what's the mechanism of action of metformin, what are its potential side effects, and, a little bit maybe more straightforward questions. Whereas, clinical BCACP exam or BCPS or whichever is a little more thought-provoking, where you're presented a situation and you have to recognize can I use metformin here? Is their kidney function okay? Would it be contraindicated due to something else? And so on and so forth. So that kind of clinical reasoning thought process. So, recognizing those drugs of choice and making sure you recognize your backup plan. So if a patient has an allergy, kind of continuing on that metformin example. So if they have an allergy to metformin or are intolerant of metformin, okay, well, what are you going to choose next? What's the best choice in this patient with an elevated A1C? Okay, so that's the way I think you want to approach studying. So selecting drugs, contraindications are going to be really, really important. Recognizing that you probably shouldn't use NSAIDs in renal failure or in heart failure. Good example there. Severe adverse effects. So if you've got something that's really, really rare, really unique to a specific medication, clozapine and agranulocytosis, that's really kind of an easy one. But I think you kind of get the point. If there's something really serious, really unique to a medication, that's something that definitely you might need to know clinically, and it might apply to a patient case that you're being asked about. Monitoring parameters, so if somebody's on a drug and they present with a new symptom, a new problem, maybe they're due for follow-up lab work, recognizing what that monitoring is going to be and making sure you're aware of that is a good thing to pay attention to and study for. And then, of course, common adverse effects. Sulfonylureas cause weight gain and hypoglycemia, and recognizing those common adverse effects and how they might relate to one of your patients. Okay, well, this patient's already morbidly obese. Is there something else that might be better than a sulfonylurea that doesn't cause weight gain? Okay, so looking, assessing, reviewing a case, and remembering some of these contraindications, drug interactions, adverse effects, and kind of hallmark things with each medication. And then, of course, the guidelines, the drugs of choice, and where they're going to fall. Now, the non-clinical portion, the non-pharmacotherapy section of the exam, which, ballpark's probably 30 to 40%. Statistics. Absolutely have to know statistics. We've got a great study guide on that with some practice questions in there as well. Billing codes. So this is unique to ambulatory care. We're talking about some of those MTM codes, maybe transitions of care codes, diabetes codes. Certainly fair game, and as part of developing an ambulatory care practice, you're going to have to recognize where you're going to generate revenue and or create cost savings. And billing codes is a good example of something that might come up on there. Certainly regulatory things might come up. I think of, the FDA and, what's their role, reporting rare, unique adverse effects and different programs of that nature. Important things there. I kind of mentioned the ambulatory care practice and business models and, thinking in terms of that respect as well, which we've covered some of that in our study material as well. As far as the specifics with study materials, what are you looking for? As far as the pharmacotherapy side of things, I would, take a broad overview and also think of things that'll show up a ton in ambulatory care practice. So you've got things like diabetes, you've got things like hypertension, hyperlipidemia. Those show up all day, every day in an ambulatory care practice. Okay, so you better know that stuff inside and out. Risk factors, drugs of choice, contraindications to certain drugs. Definitely know more details on those big, broad topics. Now, you get something like multiple sclerosis, there's a lot of complexities to MS and MS treatment and things like that. But there, it's a little bit more of a specialized thing, so I would focus on maybe recognizing some of the agents and maybe, understanding side effects and maybe how MS might impact that patient and medication selection. So, again, in some of those less common disease states, I would definitely take a much, much broader overview in your study preparation. In the disease states that are really, really common, you need to know the insides and outs of hypertension and diabetes, maybe an osteoporosis, maybe pain management, maybe things that come up much more often on a much more regular basis. Focus on weaknesses. So in practice, it may be advantageous to actually have a really specialized area that you're good at and nobody else is. On these broad certification exams, it definitely doesn't do you well to be very, very good only at one or two areas. So if you're really good at anticoagulation, for example, well, you've got a lot of other areas to cover and maybe other weaknesses that maybe you haven't studied at or looked at in a long time. So if I was, a primary a warfarin clinic pharmacist, and that's what I did all day, every day, and I'd done it for the last 5 or 10 years, I would probably study that hardly at all. I wouldn't even hardly look at that section. I would definitely be focusing my efforts on other disease states that maybe I've overlooked. I strongly encourage doing at least one practice exam. Certainly doesn't have to be through our website, but I would encourage you, wherever you get that content, to time it and make sure you do at least one practice exam. And if you're a moderate to slow test taker, if you remember from school or the NAPLEX, and you barely finished or you barely got done, then absolutely, you have to do this. If you're a very, very fast test taker, maybe you can take a chance and get away with not doing a practice exam. But, for as much money as you spend on taking the exam, it would not be fun to run out of time and have 5 or 10 questions left that you didn't get to or you had to rush through. So again, there's the official time. It's about 4 hours and 23 minutes total for 175 questions. So less than 2 minutes per question, which definitely doesn't seem like a lot of time at all. Just wanted to show you our study material. So meded101.com, if you just go to the main webpage, meded101.com, you can see the arrow there. Our AmCare stuff will be found right there. We've got a review course available. We do have nearly 20 hours of content just covering all the different topics within the content outline of the BCACP material there. Certainly it's nice. You don't have to travel. It's, on your own leisure. They're recorded. A nice potential resource there. I've got 2 practice exams as well on the website. They're downloadable PDF format. I review and update these on an annual basis just to make sure content is still relevant according to guidelines and different stuff like that. Stats study guide. This has been a real lifesaver for a lot of people. I've heard that. So that's a nice added advantage there you can get. And then probably the most common thing people purchase from the website now at this point, since I've created all these materials, I do lump them into an all-access pass, and you can get access for 6 months or up to a year if you want it as well. A year is obviously a little bit more expensive. So I have added in all those things I mentioned there. Those are all included. And then also I've been working on getting some medication comparison tables. I know some people like to study that way. So I've got, 10 of those, I think 8 to 10 of those put together for 2019 just to kind of help facilitate your study time. So yeah, you can find that at meded101.com. I think a really neat and unique resource where you don't have to pay, $500, $1,000 to go travel somewhere and take a live review course. So I have had a few nice comments regarding the study material that we have on the site, and certainly gracious to these folks for giving their word of encouragement to me and backing what we've put together. So if you have any questions, you can certainly reach out to me through the website. Just hit the contact button and those emails go right to me. I did want to give you one sample question. Just kind of a little bit more of a straightforward one. Don't have to think too much through the case, but patient has had repeated gout flares, is questioning if any of his supplements could be contributing or exacerbating his gout. So if you remember, niacin is notorious for raising uric acid levels. Hydrochlorothiazide's is another one. Some of the anti-rejection transplant drugs can also raise uric acid. So just kind of a good little question here, kind of a sample question from one of the practice exams, one of the 350 you'll get on the website there. So hopefully that gives you a little sense of the BCACP exam. I hope you find this helpful. Like and share this video. That's greatly appreciated. Again, feel free to reach out, meded101.com, hit the contact button if you've got any questions about the exam specifically, and or any of the resources that we have available. Thanks for listening. Take care. Hope you have a great rest of your day.